Hello everyone, my name is Brady McLaughlin with Go Rescue Brands Inc., DBA, Trio Safety, CPR, and AED. We're an American Heart Association training center proudly located right here in Birmingham, Alabama. Thank you for being involved with this American Heart Association Go Red for Women event. This session is also sponsored by Medical Properties Trust. We thank you for your kind donation to make this session a reality. So over the next few minutes, I want to give you two things. Number one, how to do CPR, and number two, how to use an AED to save a life. We've all seen and heard about CPR. Some of us have maybe even done that, whether it's been in training or on a real patient. But what I want to do today is have you walk away from our very short time together with the practical skills that you actually need to save a life. Let me say it this way. My wife, my family, and I all live in Birmingham. We work here, we enjoy recreational time here, we go out to eat here, we go to church here. If any of you were to see us and we were in cardiac arrest, I want to make sure that y'all are prepared to save our lives, or at least give us the best chance of survival. We are very thankful to be partnered with the American Heart Association and their efforts globally to help make life-saving easier for people in response areas all across the country, whether it's in the clinical setting in hospitals, whether it's the lay provider like many of you who have professional backgrounds and who may need to use CPR on someone in their own homes. We appreciate the American Heart Association's effort through their emergency cardiovascular care programs. So without further ado, let me show you how to do adult CPR. All right, adult CPR. This is probably the most common type of patient that you would need to do CPR on. So if you think about it in the context of your own world, where could someone go into cardiac arrest? Studies show that 3 out of 4 sudden cardiac arrests happen in the home. And they actually happen early in the morning. It could be a Monday morning. And the most common place of arrest is in the bathroom or even in the bedroom. Maybe because we spend time there. What I would tell you is this. If someone is standing up and experiencing chest pain, they're having a heart attack. If someone's laying flat on the ground and not moving, not responding, and not breathing, they're having sudden cardiac arrest. Essentially what just happened was their heart is no longer working properly to be able to effectively pump oxygenated blood around the body. There could be an electrical issue with it or a plumbing issue with it. Either way, it's a life or death emergency and they now need treatment by you as the bystander. If someone's having a heart attack, remember the person standing up, call 911. So the first step is we show up and we see if they need help. Hey, are you okay? They're not responding. We don't see any signs of life. I'll tell you this as a side note, studies show 10 out of 10 people taking a nap don't like CPR being started on them, okay? So for what that's worth, check to see if they actually need your help. If they're not responding, send someone to call, or you call yourself 911 or the emergency response number. When you call 911, that initiates a cascade of events that hopefully ultimately places the patient in what we call definitive care or in the hospital. All right, next we're going to remove the clothing from the patient's chest. Then we're going to start high quality CPR. We're pressing hard and fast to the beat of the song Staying Alive. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. We're to continue doing compressions until the patient becomes responsive or until EMS shows up and takes over. Either way, we are providing high quality CPR by pressing hard and fast in the center of the patient's chest. It's helpful to count out loud so you don't lose your space, and also it helps you stay on beat. You want to be sure to press in the very center of the patient's chest, right between the nipple line, while keeping your arms locked, your fingers interlocked, and your shoulders centered straight over the patient's chest. Okay? Just like this. So that's adult CPR. Some of you may ask, do we still give breaths? Absolutely. If you're certified and trained through an official certification course through the American Heart Association, follow that protocol. Use a barrier device and give rescue breaths after each set of 30 compressions. However, for today, this is called a hands-only CPR, and we know that this can help save a life. Next up, I want to show you how to do CPR on an infant if something were to happen there. So babies are classified as anybody under 1 year of age. Very, very simple, same steps. You're going to tap and shout and see if they are okay, see if they need any assistance. Send someone to call 911 or you do it yourself, And then instead of 2 hands, we're going to use 2 fingers in the center of the patient's chest to give hard and fast compressions. It's still the same song, Staying Alive. What CPR does when we do this is help perfuse the tissues, the cellular level of the body that needs oxygen. That's what this does. And when someone goes into cardiac arrest, most patients have about 3 to 5 minutes of oxygen still in their system to be able to perfuse the cells. That's really good if you think about doing CPR and using an AED until EMS arrives on scene. One of the other critical parts of the chain of survival is called rapid defibrillation. Some of you may have seen it on TV where they warm up the electrodes and shock a patient with a manual defibrillator. Reality, though, is this is what corrects the electrical arrhythmia that's happening in the heart through an automated external defibrillator, or AED. Automated means that it decides if the patient really needs a shock. You don't have to interpret any heart rhythms like they do on TV. External means that the pads are applied on the outside of the patient's chest, on the upper right and the lower left. You don't have to do surgery or implant anything in the field. Defibrillation means the prefix DE means undoing something, and fibrillation means a quivering motion of the heart. So what's really happening during sudden cardiac arrest is the heart is starting to quiver. It's in one of 2 different rhythms. And what needs to happen is the electrical shock is introduced to the heart. It kind of resets the table, if you will, of the heart, and then allows a new rhythm to be restored from within. Here's a good way to think about it. If you have a computer, it's plugged into the wall, but it freezes. It still has power, but the computer is frozen. The best way to reset it is press and hold the power button. We all know what will happen next. If everything works right, pressing and holding the power button will result in a hard restart of the computer. In a very similar way, that's what the AED is doing to the heart. It still has power, it still has electricity, but the electricity you introduce through the AED can help stop the bad rhythm and restart a new one. So AEDs come in all different shapes and sizes. Right now there's 6 that are approved by the FDA. This AED, and as like most others, are very easy to use. They usually consist of a power button, and some of them, which are semi-automatic, require you to press a shock button to deliver a shock. I'm going to turn it on so you can see. It walks you through all the steps you need to know how to save a life.
Patient, call for medical assistance.
Prompts you exactly what to do.
Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads.
Here you can remove the pads of the AED and then begin with applying them to the patient's bare chest.
Peel pads from liner.
So once you apply the pads to the patient's bare chest, it'll start analyzing the heart rhythm to see if a shock's needed. Guys, the AED will only give a shock if a shock is truly needed. There's no risk in accidentally harming the patient. Next, if a shock is needed, it'll tell you to stand clear. You want to make sure everyone's clear. And then finally, once the light button lights up, or the lightning bolt lights up, you can press the shock button, or on this one, it's a fully automatic. It'll automatically deliver the shock and do a countdown. When a shock is delivered, you will see some possible body movement from the electrical impulse that's going to the heart. That's okay. That's working to treat the patient. After that, then you'll resume CPR, just like we learned, with hands-only CPR, hard and fast compressions to the rate of about 100 beats to 120 beats per minute. I wanted to tell you something about these AEDs. Check your home. You probably don't have one, where most cardiac arrests happen. Check your place of business, your house of worship, your school. Make sure that they have them. Really, we need these to be proliferated so they're all across the country and in all the areas of need, so that we can compress that chain of survival and help make stronger outcomes. And if you think about it, this is the only device in the world that can not only diagnose but treat a life-threatening condition, which is sudden cardiac arrest. On behalf of Medical Properties Trust, who sponsored this session, and Go Rescue Brands Inc., an American Heart Association training center, we appreciate you attending today and participating in the Go Red for Women event here in Birmingham. Y'all have a great day.